Sandy, we've been talking about the barriers that patients face with regard to treatment. Can you speak to some of the obstacles or barriers that are faced by healthcare providers with regard to treatment for small cell lung cancer?
Yeah, well, there's a couple ways to look at it. First, if you just look at a clinical trial perspective, sometimes it's hard for us to enroll patients with small cell lung cancer for several reasons. You know, when we enroll in a clinical trial, a lot of times we need to wait for a slot to open. Well, we don't have time to wait for a slot when they have small cell lung cancer. Again, it's a very aggressive disease that's rapidly moving. So we run into this barrier all the time here because they'll say, well, I have a slot that opened up in 3 or 4 weeks. I don't want to wait that long to treat my patient. So I think when we design these trials, we have to think about those kinds of things. Another point of putting patients on clinical trials is a lot of trial ineligibility criteria is for patients with brain metastases. But in small cell lung cancer, we know that like up to 75% of them are going to develop brain mets over the lifetime of their disease. So it's not really a real world trial if we exclude patients with brain metastases. So we need to design our trials in a good way. There's a lot of other barriers that we end up facing. Some of the treatments for small cell lung cancer, especially a very new treatment that's a BiTE therapy, a bispecific T cell engager, is very hard to administer. It requires an overnight admission for the first two treatments. It has taken us actually a pretty long time to operationalize how we were trying to give this. So it's not easy. And we finally have figured out how to give this, but this is a drug that holds a lot of promise for our patients, but it is hard for us to administer. And it's hard for patients as well, because then they have to say, oh, I have to block off an entire day for this. So, some of these treatments are not easy. Most treatments for small cell lung cancer are not fancy targeted therapies that can minimize toxicity. These are chemotherapies that can cause nausea, fatigue, lowering of blood counts, the majority of the treatments. So if our patients aren't healthy, robust, and able to deliver, or we can deliver the treatment, but they're not able to handle the treatment, that's also, worrisome and can cause a barrier for us. So they're not easy treatments. We need to really do our best to help support the patient and help figure out from an operationalization, there I made up a word, but standpoint on how we can administer these safely, but in a quick, efficient way to these patients.